Good day, everyone. Today, we will conduct a brief yet detailed review of the histology of cartilage and bone. Cartilage is a specialized connective tissue consisting of three main types. We have hyaline cartilage, elastic cartilage, and fibrocartilage. Hyaline cartilage, which we will discuss first, is the most common and the most characteristic type. It is associated with joints, growth plates, and sutures of bones and provides a semi-rigid support to the walls of the upper airways in the respiratory tract. This is a schematic of articular hyaline cartilage and the corresponding light micrograph from a developing rat knee joint. Articular hyaline cartilage consists of four poorly demarcated zones. The uppermost superficial zone of cartilage, labeled here as number 1, is called the articular surface, and it forms the gliding surface of the joint. There are small rounded cells here, labeled as number 2, called chondrocytes, which are oriented parallel to the surface, but in deeper zones, the chondrocytes become larger, more rounded, and they are arranged in vertical columns. The deepest zone, labeled here as number 5, is called the calcified cartilage zone, which, as the name implies, is comprised of calcified cartilage. And it separates the hyaline cartilage above from the subchondral bone below. Besides the articular surfaces of joints, hyaline cartilage is also found at the ends of the ribs where they join the sternum and in the upper respiratory airways, namely in the tracheal and bronchial segments. Shown in this slide, for instance, is low and high magnification of hyaline cartilage in the trachea. At these sites, a perichondrium, labeled as number 1, a perichondrium, surrounds the cartilage. Blood vessels in the perichondrium, such as the one labeled as number 2, provide oxygen and nutrients, which diffuse into the avascular cartilage. We see here again some chondrocytes, labeled as number 4, chondrocytes in hyaline cartilage, which are often arranged in pairs or in groups of 4 to 6. The cells of each group make up an isogynous cell nest. So a pair here, grouped together, is called an isogynous nest, labeled as number 5, because they are the progeny of a single chondrocyte during development. Type 2 collagen fibers, water and ground substance constitute the territorial matrix, labeled here as number 3, the territorial matrix. It is the collagen fibers which impart eosinophilia to the matrix, but are not visible by light microscopy because they have a similar refractive index to that of the ground substance. The basophilia, on the other hand, in the interterritorial matrix, labeled here as number 6, the more basophilic matrix here is called the interterritorial matrix, is due to the presence of glycosaminoglycans or GAGs, such as chondroitin sulfate in the ground substance. Fibrocartilage is found in the annulus fibrosus of intervertebral discs in the spine, symphysis pubis, menisci of synovial joints, and at points of attachment of tendons to bone. It is a mixture of dense, regular, connective tissue, similar in many respects to tendon or ligament, and hyaline cartilage. Functionally, The benefit of this is that it combines the tensile strength, the firmness, and the durability of tendon as imparted by the dense regular connective tissue and the resistance to compression of cartilage. In contrast to the other two types of cartilage, fibrocartilage has no distinct perichondrium, blending imperceptibly with the surrounding connective tissue or hyaline cartilage. Its matrix, as we can see here, is intensely eosinophilic due to the presence of numerous collagen fibers. Shown here is a schematic and the corresponding light micrograph of an intervertebral disc. Labeled here as number 1 is the spongy bone of the vertebra. 2 is the nucleus pulposus. And surrounding the nucleus pulposus is the annulus fibrosus. Finally, the most external is the compact bone of the vertebra. Shown here is the light micrograph of elastic cartilage in the epiglottis, stained with the usual hematoxylin and eosin stain, and the same elastic cartilage stained with a special stain called a Van Giesen stain. A Van Giesen stain is used specifically to highlight elastin. Elastic cartilage is one of the three main types of cartilage. We recall that the other two are hyaline cartilage and fibrocartilage. And elastic cartilage provides structural integrity to the auricle of the ear, to the epiglottis, and to the eustachian tube. It is resilient. It returns to its original shape easily after being distorted and has more flexibility and, as the name implies, elasticity than the other two types of cartilage. Its matrix, labeled here as number 2, contains a dense interwoven network of elastic fibers embedded in a small amount of amorphous extracellular ground substance. The elastic fiber network is more dense in the interior than at the periphery. Again, we see here some chondrocytes labeled as number 1. They are spherical in shape and they are contained in lacunae. They are similar in appearance to the chondrocytes of hyaline cartilage, except that they are more closely packed and, as we have previously discussed, they are usually encased in a spherical structure called a lacuna. Only a few isogynous nests of chondrocytes are present, and the high refractive index of elastic fibers imparts a lightly eosinophilic staining pattern in conventional preparations. With special methods that selectively stain for elastin, as we can see in the second image, the branching and the anastomizing nature of the elastic fibers is more clearly appreciated. Speaking of chondrocytes, chondrocytes share similar fine structural features of other connective tissue cells, such as fibroblasts and osteoblasts. Chondrocytes synthesize and secrete proteins, especially collagen, and ground substance, such as proteoglycans and glycosaminoglycans. In hyaline cartilage, type 2 collagen fibrils predominate in the matrix and form a loose three-dimensional network. At least two other collagens, aside from type 2, namely type 9 and type 11, assist in stabilizing the type 2 collagen fibrils. Shown here is a schematic of hyaline cartilage and the corresponding electromicrograph of a chondrocyte in the same hyaline cartilage. Labeled here as number 1 is, of course, the nucleus of the chondrocyte. 2 is the surrounding plasma membrane of the chondrocyte. 3 is the matrix. 4, appreciated in the electromicrograph, is rough endoplasmic reticulum. And 5 is a mitochondrion. In the fetus, hyaline cartilage forms a provisional skeleton, which is eventually replaced by endochondral bone formation. Soon after fetal life and up to adolescence, hyaline cartilage at epiphyseal growth plates is responsible for the growth, elongation, and the shape of long bones. The cartilaginous growth plates in a typical long bone are confined to its two ends, and they provide temporary scaffolding on which new bone is laid down. The growth plate promotes apposition of new hyaline cartilage at the end facing the epiphysis. This is followed by cartilage destruction in lower regions and its replacement to primary spongy bone in the deepest region, which is called the metaphysis. This is a schematic of the growth plate from a long bone, and these are the different labeled parts. Number 1 here is called the reserve zone. 2, containing the most surface area of chondrocytes, is the proliferative zone. Below the proliferative zone is the zone of maturation and hypertrophy, and below it is the zone of provisional calcification. Number 5 here, going deeper, is the zone of ossification for the primary spongiosa, and below it, which is the most ossified layer, is the zone of ossification for the secondary spongiosa. Therefore, we note that as we go deeper into the growth plate, the more the structure becomes more calcified or ossified. Shown here is a schematic of spongy or trabecular bone and the corresponding light micrograph of a trabecula in spongy bone. Osteoblasts, labeled here as number 5, the basophilic cells over here, are bone-forming cells derived from the progenitor cells present in the surrounding connective tissue and bone marrow. They are polarized cells that synthesize and secrete unmineralized osteoid. Osteoid is the newly synthesized bone, which is labeled here as number 4. They have a pinkish reddish hue. Later on, the osteoid becomes mineralized. Its main components include type 1 collagen and the glycoproteins osteocalcin and osteopontin. Osteoblasts also synthesize alkaline phosphatase, a cell surface protein that promote mineralization and formation of hydroxyapatite in the bony matrix. But the bony matrix is labeled as number 3. It is literally the ground substance in between the different cells of the bone. As ossification proceeds, the osteoblasts, again labeled here as number 5, eventually become trapped in bony matrix, and they then are called osteocytes. Another special kind of cell in the bony matrix is the osteoclast. Osteoclasts are specialized multinucleated cells whose major role is the opposite of the osteoblasts because they resorb or basically destroy bone by maintaining a low pH in the resorption cavity. Depending on the orientation of collagen fibers in the bony matrix, bone tissue is organized as either primary, also known as woven, or mature, also known as lamellar bone. woven or primary bone, or mature or lamellar bone. Woven bone is present in the bones of fetuses and young children and is characterized by coarse collagen fibers that are oriented randomly. Lamellar bone, on the other hand, begins to form shortly after birth and actively replaces woven bone by about age 4. Trabecula in mature bone is made up of lamellar bone and is intensely eosinophilic, embedded in the matrix or osteocytes and their lacunae, which are small and spindle-shaped. Shown here is a light micrograph of fetal bone showing a developing bony trabecula and a light micrograph of a trabecula in mature spongy bone. Labeled here as number 1 is an osteoclast, and 2, embedded in lamella, is an osteocyte. Number 3 here are osteoblasts. To review, we recall that osteoclasts chew up bone, they cause bone resorption or destruction, whereas osteoblasts, we can remember from the letter B, builds bone. It builds upon the bony matrix. 4 here is a blood vessel, and 5 is woven bone. 6, on the other hand, is lamellar or mature bone. And 7 here is a fat cell adipocyte. Most bones contain both compact, also known as cortical, and spongy, also known as trabecular bone. Their relative amounts and distribution within bone varies with age and according to function. Compact bone, for example, is limited to the outer shell or cortex of the bone. It is composed of many adjacent Haversian systems, also known as osteons, that appear round to oval in transverse section and are usually oriented in the long axis of the bone. Each osteon is a cylindrical unit measuring about 250 micrometers in diameter. It consists of a central Haversian canal, such as seen here. This is a Haversian canal, which contains small blood vessels and nerves in it, and is surrounded by 4 to 20 concentrically arranged lamellae. Shown here is a schematic of the cortical region of bone and the corresponding light micrograph of compact bone. Labeled as number 1 in the schematic is the periosteum of the bone, and 2 is a capillary inside a Haversian canal. 3 are the concentric lamellae surrounding the Haversian canal, and 4 is an osteocyte embedded in the lamella. And 5 is the trabecula of the bone. The synovium is a delicate and highly vascularized lining of the synovial joint. The intimal lining cells, known as synoviocytes, are modified connective tissue cells rather than epithelial cells. The synoviocytes form 1 or 2 cellular layers concentrated along the luminal surface, giving the false impression of a continuous cellular membrane characteristic of epithelia. However, the synoviocytes are not joined by intercellular junctions, and they also do not have a basement membrane. There are two types of synoviocytes. We have the type A, which comprise 20 to 30% of the synoviocytes. These are actually modified phagocytes derived from monocytes, and we have the type B synoviocytes, which are modified fibroblasts. So type A, modified monocytes, and the type B, synoviocytes, are modified fibroblasts. And because they are derived from fibroblasts, they synthesize matrix components such as glycosaminoglycans, and glycoproteins. Shown here is a light micrograph of rat knee joint and the corresponding high magnification of a synovium. One here is the meniscus of the joint, and two is the synovial cavity. Three is synovial villus of the synovium, and four here is the articular cartilage. The deep pale staining layer here is the subintimal layer of loose connective tissue.